I'm Steve Adubato, and I am honored to welcome two very special medical professionals who are joining us to talk about oral health, dental health, and our veterans. Dr. Jean Napoliello is president of Delta Dental of New Jersey Foundation, and Dr. Sam Wakim is chief dental officer of Zufall Health. Zufall Health is?
It's a community health center based out of Dover, New Jersey, but we have sites all throughout northern Jersey and central Jersey, and we provide both medical, dental, as well as behavioral health services and a wide range of supportive services to our patients.
Right. And Doctor, help us understand this. The Delta Dental Foundation is?
A charitable entity that serves the public in New Jersey. Anybody with a bona fide charitable need can go to any one of a number of clinics statewide, one of which is the Zufall Center. They've been our partners for 25 years, and they've grown with us, and that's what people can do.
So let's talk about this. Missions of Mercy. What is Missions of Mercy?
Well, Mission of Mercy is a national movement. There's a national entity that controls all the Mission of Mercies and works with them. In this case, I've been to Connecticut's Mission of Mercy. It's a large mass unit that's in a big arena. It's plumbed, electricity, and hundreds of professionals treating anybody who wants to come. These people sleep at night online, and it wraps around the building.
Dental health.
To get dental care, right.
And by the way, Delta Dental of New Jersey does in fact support them and have been for the past 8 years or so. Who are the people who are coming in for help? What kinds of people are we talking about here?
Well, up in Connecticut, it's everybody. They come from all over. People who don't have insurance, basically. The insured and the uninsured, but mostly the uninsured.
But they came to New Jersey when?
So this is our first
No, but Jersey is going to be the first time.
Jersey's the first.
This is the first time we're doing it here, and we're going to do it for veterans. We've had an 8-year experience with Connecticut.
Talk about the veterans' needs.
So for the inaugural event, we decided to focus on veterans because veterans, once discharged from service, they do get medical care, but they do not receive dental care unless they have 100% service-related disability.
Sure.
So most veterans don't get dental care, and as you know, dental care is important because it's related to overall health.
Explain that to folks. We've had discussions before about overall dental health, but if in fact a veteran comes back, he or she comes back, and they do not get the dental, the oral health care they need, what else could happen?
Well, we know for sure that there's strong evidence that oral health is related to cardiovascular health, and our data consistently shows that people who receive dental care have much better chronic disease outcomes than those who don't receive dental care. So if you're a diabetic patient, if you have high blood pressure, other chronic diseases, if you're not getting regular dental care, we know that you're going to have poorer health outcomes. We don't know exactly the mechanism in many cases, but we definitely know that
nothing good happens.
Right.
This inaugural initiative, Doctor, is called Smiles for Our Heroes, right?
Right.
And how are we getting veterans to, again, we're announcing it here, we're talking about it right here, but how do we reach out for veterans right now?
Well, Zufall is doing it locally, mostly in the northern part of the state. Since this is our first time, we want to keep it small. We're getting our feet wet. So this is how we want to approach it. There are going to be up to 200 appointments, slots, that veterans...
Scheduled slots that
Scheduled
veterans have.
slots at Dover, right. Plus the...
Dover
Zufall, yeah, their clinical site, plus they have a van where we have 2 chairs on the van.
Okay.
So we're a major sponsor, Delta Dental of New Jersey.
We're seeing some of the pictures right now, but
okay.
So these veterans are going to come in.
Yes.
What's going to happen for them?
Well, they're going to get the basic care that they need: radiographs, X-rays, cleanings, exams, extractions, and simple removable dentures. Some of these people don't smile, so that's what it's going to be: smiles for veterans.
So let me ask you a question. While they're serving, because we've been doing this series that has talked about services that are out there. First of all, what do veterans need? Where are the services for veterans to find those services? And we're putting up website information throughout this program. You pick it up and use it.
Good.
But here's what I'm curious about. While these men and women are serving, are they getting dental care?
Yes. So They do get dental care before deployment as well. So about 40% of recruits entering into the military have at least 3 or more cavities.
Hold on. Say the number again.
So 40% of recruits have 3 or more cavities entering into the. So you could say it's a national security problem, because if they're not ready for deployment, they're not ready. They have to get their dental work, ahead of. Being able to deploy. So they do get their care. They do get their care while they're in.
But when they're coming home, they're not thinking about this? I'm not saying, I shouldn't say across the board. What is happening for them? Because they've got to deal with getting a job, a house to live in. They got to,
no dental home. They come back out of the home that they had in the service. They don't have a dental home. There's no connection.
No dental home.
Right.
No place to say, hey, this is where I'm going to get my dental care.
Exactly.
That's so interesting. You would think about all the needs that veterans have. This is huge, because people say, oh, so it's your teeth. No big deal. A huge deal.
Can't get a job without teeth. In many cases, many of the veterans who are missing, front teeth cannot get.
Jump back in, doctor.
So even if the decay is taken care of, let's say in the service, they're still subject to periodontal disease. That continues on and on. In fact, it's more prominent in the later years. So here they come back, and they're absent any The key here is continuing care.
So go back for a second. This Missions of Mercy initiative coming over here to New Jersey. The Smiles for Our Heroes is an event, an important event, but this is going to be an ongoing effort.
Ongoing.
Describe it, doctor.
Well, because we have funded the clinic so that they're going to screen these patients before we treat them on Veterans Weekend. Okay. Then we're going to follow up. There's enough money for them to get follow-up care so we can have the continuity. If you just do a 1 or 2 day thing, no good. We want them to have their home.
How do they continue to get that care?
Through the clinical sites that they have.
So
talk about that, doctor.
So, being community health center, we see patients. We provide affordable pricing for patients who need us in the community.
Is it based on the ability to pay?
It is to some extent, and what Delta has done is
they're subsidizing.
We're subsidizing the care.
Right.
There should be no reason why they just can't be taken care of.
Sorry for interrupting, doctor. If some veteran says, I can't afford it,
that's not an issue. Yeah. The subsidy, when we fund the clinic, there is enough money in there to pay for any copay or any cost that the clinic has.
Yeah. Let me ask you, this is less of a dental or oral health issue than it is more of a larger question of, I'm not going to get overly philosophical, but what we owe our veterans. What do you think we owe those who have given to our country?
I think it's very important to take care of our veterans. Our community health center was, started by volunteers, and our veterans volunteer to serve and protect us. And I think we definitely.
Doctor.
They took care of us. Now it's our turn to take care of them. When our chairman of the board, Dr. Deblinger, Ronald Deblinger, went up to Connecticut in 2015, he came back. He was inspired, and he set a goal. Let's take care of our veterans in this state, and let's do it through our foundation with partners. We finally looked around. For 2 years it took us to find a partner as good as them. And we couldn't find them. Finally...
You found Zufall.
Well, we knew about Zufall, but...
And they have great reputation.
Great reputation, and it took us 2 years to get together to figure this all out. So we're excited, very excited, because, veterans are...
We owe.
We owe them.
We owe them, finally.
I agree. I hope this snowballs and this grows, but we want to,
Right. It's 9 chairs, 9 treatment rooms currently for this current one. But next year, we want to increase the number of chairs so we can increase the number of care.
Thank you so much, Gene and Sam. We appreciate it. Well
You're
done.
welcome.
Thank you so much. Thank you for
We'll be right back right after this.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by the Healthcare Foundation of New Jersey, Seton Hall University, Suez, Summit Medical Group, Choose New Jersey, Verizon, and by the law firm of Gibbons PC. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.